Hello, my name is Maria Mills. I'm the Chief Executive of Active Prospects. We're a learning disability and mental health charity working in the southeast of England, supporting 200 people, often with complex needs, with our 400 staff. And my piece today is just some reflections on yesterday's announcement in Parliament by the Prime Minister on the social care reform plan. So firstly, absolutely fantastic social care is being discussed. Really, we kind of welcome that. But our concern is that over the next 3 years, the parity between the NHS and social care just isn't there. Only 1/6 of that new funding that is being gratefully received from the National Insurance levy is actually going to be going into social care. And quite a lot of that, probably 2/3 of that, is actually going to be about administration and quite a complex system, and also to replace some of that funding that individuals no longer need to pay for their own social care. So actually we see 1/36 of that new funding actually going into additional resources. And this is in response to a social care crisis where we have 1 in 10 staff vacancies in our sector. So people, already exhausted from 18 months of working through COVID, having to cover for other staff because of those gaps. And I'm sure you've heard some of those stories within the news media. We're in a recruitment crisis right now. And when the Prime Minister was discussing wages, he mentioned the increases to the national living wage, but that's minimum wage. Our jobs don't deserve minimum wage. They do medication, they do support people's complex health conditions, they support complex behaviours, they support kind of motivational kind of skills in terms of enabling people's independence. These are not minimum wage jobs. So we need to ensure parity between jobs of equal value being funded publicly to, that level playing field. And our staff deserve that parity in terms of paying conditions to NHS staff. We, as the public, would expect that contracts delivering those services would have that level playing field and recognition of the value of those respective workforces. And then finally, we need to ensure that the voices of people who use services are absolutely at the centre of any reform. And, we haven't heard that yet, and they absolutely need to be driving what is, delivering great care. Thank you.